Okay. Good afternoon, everyone. My name is Galen Wisdom, and welcome to the Man to Man Fatherhood Initiative, our live session. Today, we'll be talking about men's health. And what in men's health, we'll be talking about STDs. And that's something that's very important for us to understand. How does STDs affect the family? How does it affect us as men? And how does it affect us as we try to live our livelihood and provide for our family? Today we do have with us Trevor from the Bennettsville office, and also we do have our guests from CareSouth. So I'll just allow our guests from CareSouth just to introduce themselves to us.
Hey, how you doing, everyone? My name is Mark Calhoun. I am the Director of Social and Community Services with CareSouth Carolina. And with me from South Carolina is she is the Director of Care Innovations for South Carolina. Oh,
Hello.
Yes. Good. Hello. Yes. So please feel free to message your questions once we start talking, and we'll see how best we can answer as best as possible. So, Miss McQueen, please go ahead and take us into what you have prepared for us today.
Yes, sure. So I'm Hope. I'm the program director here at Care Innovations. And basically, what we're going to speak on this afternoon is men's sexual health. And the objection that we're going to deal with is we're just going to review male sexual anatomy. We're going to explore common men's sexual health issues and how to manage and prevent those, and learn about types of common STDs and their causes and symptoms and treatments, and also learn about STD testing and the importance of prevention. Also, some of the slides that we're going to show, I think for the next couple of slides, may be a little sensitive. So just wanted to give you kind of like a heads up. All of us are adults on here. So, well, first of all, the male reproductive system, which clearly it shows you how all of you men are built down there, and it gives you certain labels. It identifies, you can identify and see everything that you have down there. So just keep this slide in mind as we go through the next few slides, and you'll be able to see the main types of male sexual dysfunctions. This is just some of the reasons, mainly the good reasons why things are going on. You have erectile dysfunction. That just means that men have difficulties getting up and staying up, getting an erection. Premature ejaculation. That means like reaching your orgasm too quickly. Delayed or ejaculation. That means reaching orgasms too slowly, or sometimes not at all. And then the last one is your low libido, which means reduced interest in sex. The causes of the sexual dysfunction in males are several different reasons. The physical causes are low testosterone levels, prescription drugs. Sometimes when a male starts accumulating high blood pressure, cholesterol, diabetes, and things of that sort, they have to get put on meds. And one of the side effects of the meds will cause a male to not be able to get it right and keep it right. Blood vessel disorders. Marek, don't you do it. Also, stroke and nerve damage from diabetes, as I said earlier. Smoking. This is one of the reasons why we do not like smoking. And then also alcohol and drug abuse. The psychological causes is just men, sometimes they're concerned about their sexual performance. If they're having any type of marital or relationship problems, depression. Depression is really popular these days, especially with how the economy is going. with males being the head of households and not being able to provide. So that plays a large role now, right now. Past sexual trauma, if they have been raped in the past or something to that matter has happened with them, or work-related stress and or anxiety. Next.
Can I just say something, Miss McQueen?
You sure
And I
can.
mean, just talking on behalf of men, I mean, a man's sexual performance is very, very, very important. And so, I mean, that affects us men deeply. And I mean, I just want to say that men, feel free that you find someone to talk to where this is concerned. Because I mean, there are different ways that this can be dealt with, but men don't tend to talk about this a lot because they are
Yes.
embarrassed to talk about it. So in just reaching out to our fathers to say, I mean, please don't be embarrassed if you're going through a situation like this and you do need help in order to solve them, because some of these issues that is laid out right here is some of the reasons why you experiencing sexual dysfunction.
Exactly. And that is a very good that was a very good piece of information that you just brought up, because we as African Americans, not only males but females as well, we are not taught, we are not brought up as to be a person that relate. African American men are told not to cry, not to share things of that, and in the long run, that does affect us. So I am actually going to look at a webinar and just having our African American males and males in general, to be able to tell another male that they love them. Okay. And it doesn't have to be a brother or uncle or granddad. It can be a friend that you can tell them that you love them. And it doesn't have to be anything other than that. Just showing love for your brother.
Yes.
Next. Help and prevention of male sexual health issues. I think we already kind of discussed this, but seek a healthcare provider.
Yes.
Um, okay, well, follow your healthcare provider treatment plan for any medical health conditions. Limit your alcohol and caffeine intake. Quit smoking. Fellas, please do not feel that it is too early for you to see a provider or see a doctor. Please continue to exercise. Eat healthy. Being of older, a couple of our coworkers were just talking about that. Staying in the weight room every day and being healthy and looking healthy and doing the right things was something that we did not look at 10, 15, 20 years ago. This is something new now that's on the table. So we're definitely trying to get it out there and put it out there. Next is definition of sexually transmitted diseases. This term is used to describe more than 20 different infections that are transmitted through exchange of semen, blood, and or other body fluids, or by direct contact with the affected body areas of people with STDs. STDs can affect both males and females. A pregnant woman with an STD can cause serious health problems for the baby. There are more than 20 types of STDs: bacteria, parasite, and viral. If you have a bacteria or a parasite STD, your healthcare provider can treat, cure with antibiotics and other medications. If you have a viral STD, which I can explain that, the difference between those, there is no cure. But a healthcare provider can help you treat the symptoms and possibly avoid complications. You can always get reinfected by an STD and or get another one. Prevention, testing, and treatment, they are all important. Next. General symptoms of sexually transmitted diseases. These are things that you can just look for. We all are ones that we need to check our body. We all know when things are not right. With redness or soreness of the genitals, pain at urination or cloudy or strong smelling urine, unusual discharge from your penis or your vagina, a sore or blisters on or around the genitals, near the anal or inside the mouth, excessive itching or a rash, or having pain or discomfort during sex. If you have any of those, you need to get checked out. Next. General symptoms of sexually transmitted diseases. Um, a lot of us, we abdominal cramping that persists. A lot of people wouldn't put that with STDs, but that's something that's very popular. Females, if you're having bleeding between periods, that may be a symptom of an STD. A slight fever or an overall sick feeling, like extreme high fever, that is not an usual general symptom of STDs. We'll discuss that with the HIV/AIDS symptoms later. Small note, if your sexual partner has symptoms, you both need to get checked out. Sometimes STDs do not show symptoms in a person at all. You will need to get checked out. And that is so
a lot of us, we have abdominal cramping that persists.
STDs to discuss. Bacterial and parasite STDs. When you hear that, we're talking about syphilis, gonorrhea, chlamydia, and trichomonias. Viral STDs, the human papillomavirus, genital herpes, hepatitis, and HIV. Next slide. Now, warning, graphic male pictures coming at you.
Oh, I mean, this is very, very, very important, because I mean, we need to know this stuff, and that's very important. So, listen, I mean, we're in relationships, we're doing stuff. I mean, I don't want to advocate for unprotected sex, because protected sex is very, very, very important. But I mean, if you're with a partner and you're experiencing any of these symptoms, it's very, very, very important that you talk about it, and also you reach out to a care provider. That's very important, because I would say, you don't want to use STD to stop a relationship if both parties love each other. But then again, no, you can have dialogue. You can discuss it with a care provider, and also find ways and means of taking care of it.
Absolutely.
So I just want to say that, because I guess depending on where we are from, I mean, once an STD is identified, the relationship ends right there. And there are several ways and means it can be dealt with. And that's just because, sometimes the knowledge is limited amongst persons how to deal with these situations.
Absolutely.
That's right.
Yes. Okay. Syphilis. Syphilis is caused by bacteria that is spread usually through sexual contact of a painless sore or a chance. 3 stages of the disease. The first stage involves a painless sore on the genitals, rectum, or the mouth. After the initial sore heals, the second stage is characterized by a rash. Then there are no symptoms until the final stage, which may occur years later. The final stage can result in damage to the brain, nerves, eyes, or heart, which can even lead to death. Testing is usually done from a blood sample. And there is a cure for syphilis. It's an antibiotic. Prevention, testing, and treatment, they are all important. Next slide. And this is just a graph that's showing you about syphilis. As I said, that first stage, that 3 to 90 days after exposure, no one should have any type of open sores or open wounds down in their genital area. If that is happening, you do need to go and get checked out. And one thing to also remember, as you see the 3 different stages with syphilis, once something happens to your body or your body parts, there is no correcting that. Please make sure that you stress that there is no correcting. So once you do damage to your liver, your kidneys, or anything that's going on in your body, you cannot go back and say, okay, well, I'm going to make my kidneys go back to like they were.
Right.
Doesn't happen like that. So just remember that. Here's a photo of a male that has syphilis, and that is that first stage there of that open cranker sore, sort of.
Yes.
Mm-hmm. Okay, chlamydia and gonorrhea. The common names for that is the clap or the drip. Chlamydia and gonorrhea have similar symptoms. Gonorrhea is usually worse. They can affect the anal, eyes, mouth, genitals, or throat, wherever there has been contact with the bacteria. Symptoms. Many men may experience any of the following: a painful or burning sensation upon urination, urge to urinate more often, and or have a watery or milky discharge from the penis. Many have no symptoms. Preventing and testing is key. Again, the treatment is an antibiotic. Your provider will give you, usually, if it's depending on the severity that your provider think it may be, it could be an injection of a shot, or they'll give you some type of antibiotic for 7 to 10 days. Complications: men may have persistent burning and urination inside the penis. Gonorrhea can cause sterile. You can become sterile, but this is rare. But you can get that if you are left untreated for a long period of time.
Miss McQueen, just want to ask you, please to explain that word sterile. I mean, maybe we do have persons who don't understand what that means to be sterile.
Becoming sterile?
Yes.
That means that you can have sex and you can do things, but you will never be able to produce children.
Thank you.
That's what that means. That
Yes.
means that you will never be able to have children. Okay.
Thank you very much.
You're welcome. That this is actually a gentleman that has chlamydia and gonorrhea. And I have been told that men, I have been told that when you go to urinate, that is the god awfulest, painfulest thing. It will make you want to drop to your knees. So there's no reason why you should go to the restroom and you have to literally want to be on your knees. Please see a doctor.
Yeah, that's not good.
That's right.
That's not good.
Our next one is trichomonias. Common name for that is trick. The cause of it is a parasite as well. Symptoms. Most men with trichomonias do not even have signs or symptoms. However, some men may temporarily have irritation inside the penis, mild discharge, or slightly burning after using the restroom or ejaculation. Women may have a foul, smelly, fishy discharge and redness and irritation around the genitals. Again, coming through our office here, we've had a large number of individuals that have tested positive for trich. Females have tested positive, and I tell my females this as well. It is no reason why in your vagina area should smell fishy. If there's anything like that going on, you need to see a doctor. Men, they can walk around with trich and not even know that they have it. So what happens is we have females that come in and they will get tested for trich, but they never go and share it with their partner. So they just keep coming in, getting tested and getting treated for the same thing over and over. Because there is a prescription, an antibiotic that can kill the parasite. It is curable.
Okay.
And that's just, this is just up under the microscope. Viral STDs. Viral STDs. This means that these are STDs that you may get that there is not a treatment for. I mean, there's not a cure for, but there is treatment. Many of these can be prevented by vaccines. They cannot be cured, but treatment can help with symptoms and potential complications. Seek a healthcare provider for vaccines, testing, and treatment. HPV, most commonly virally transmitted STD. There are over 40 types of HPVs identified. You can get more than one type. Some types have been linked to cause genital warts and cancer, such as penile, anal, cervical, throat cancer. Rare, but moms can transmit to babies, and children have warts grow in their throat, making breathing very difficult. The symptoms usually does not cause symptoms, but some develop genital warts or cancer. Rare, but can cause warts to grow in the throat if infected with certain types after oral sex. There's no cure for this, but you can treat it. And let me add a little bit. I think we'll see a picture or two of it. This is something that you will never. There is treatment. You will go to the doctor. Um, the doctor will what we call burn warts off. But are you guys aware of what happens with warts when you burn them off?
Go ahead, please explain.
They come right back.
Really? Yeah.
Right back, and they come in cluster form.
Right.
Next slide, please.
There you go.
Okay. Most common prevention note: vaccine for girls and boys for wart or cancer types of HPV, which we are really pushing for children, young adults, to please get vaccinated for this. Talk to your healthcare provider. Complications: men can have genital warts on the penis, scrotum, anus. They can even infect the mouth and throat. Can increase risk for anal, penile, throat cancer. Can transmit to mother, who can give to baby during vaginal birth. Women. Some types can cause genital warts, but some link to cancer too. Cervical cancer can be deadly. Get your PAPS, ladies, routine by your healthcare provider. Share this with your girlfriends and your wives.
Oh.
Genital warts. This is just a picture that just shows how the warts will come on during the penis area. And if you'll look down at that picture, like right there down at the bottom to the left, this young lady has them down there in her vagina area. I mean, I have one thing to say about this. I guess you guys can tell that I kind of do presentations.
Yes.
Take your time.
When you have sex, cut the light on.
Yes, ma'am.
Very much.
Okay.
You remember when you was young and you got into bed and you put the cover up to your neck and there was nothing on but the television light? Can't do that no more.
Right.
Yes.
Let's get some light.
Yeah. I like how you said that, because what I'm realizing with the culture now, I mean, especially amongst young people, is that questions are not being asked anymore. I mean, it's about enjoyment. It's about getting with someone. It's about, getting that one night stand. It's about, I see that person looks good. Let's get it on.
That's right.
And before you know it, here comes STD.
That's
because
right.
we did not talk, we did not check, we did not use any protectives at the very beginning. So turning on the lights is a very good it's another protective measure right now.
I'm gonna give y'all one today, y'all will never forget.
Yes.
Herpes. The common name is herpes. The symptoms: most people who are infected do not have any noticeable symptoms. If the symptoms do occur, they experience different outbreaks. Outbreaks appear as one or more blisters, and these blisters are very painful on or around the genital, the neck, and the mouth. The blisters break and they leave painful sores that can take 2 to 4 weeks to heal. The reoccurring outbreaks can happen. Generally, initial outbreaks is worse, and other outbreaks less in severity. Viruses can be on the surface of the skin and show no sign. You may never know you have it. Prevention is key. Yes, herpes are very painful. There is, however, a prescription. There is no cure. You can only treat this. I don't know if you all have ever ran across the commercial of Vardex. There are some prescription medications that can help when having outbreaks. And also outbreaks from herpes. One of the main things that will bring you outbreaks of herpes is depression or anxiety or stress. Will bring a herpes outbreak on.
Wow.
Yes.
Oh, wow.
This is a picture of an individual that has herpes. He actually has it on his penis area, and then he also has the mouth action going on as well.
Yeah. And let me ask you something. I mean, when someone displays symptoms on the mouth, is it that they're involved in oral sex for the symptoms to be on the mouth, or they don't need to be involved in oral sex for to display symptoms or signs on the mouth?
No. You could kiss someone.
Okay.
Yeah, you could never have been involved with anyone with oral sex. You can just simply kiss someone. And if they have an outbreak going on now, let me just say that
Yes.
picture that we just saw, of course, I don't think too many people would want to kiss him, but let me give you guys a little secret thing about herpes. That those blisters and those sores can be coming on anywhere from 2 to 3 days prior to this outbreak.
Whoa.
So if you interact and if you kiss someone and you have this, that is the same way it is when you are having sexual intercourse. A female or male can have this outbreak coming on at least 2 or 3 days prior, and then you can say, "Well, they wasn't there. They were there. They were coming.
Okay.
Just couldn't see it." But yes, you can get them other ways other than it does not all have to be oral sex.
Okay, let me ask this question. Say a father is displaying symptoms on his lip, mouth. What are the preventive measures that he needs to display around his family?
No kissing. I don't know if you guys ever paid in any attention. Have y'all ever noticed when people have babies sometimes and you see the mom and or the dad, the baby may drop their pacifier, and
Yes.
and the parent will take it and suck it and then put it in the baby's mouth. That is absolutely no.
Okay.
um, but you just have to, because sometimes individuals, you do know that cold sores, uh, shingles, that's a form of herpes as well. So you have to really be extra careful about things like that. And I
Okay.
would just not, you do not drink behind others and that sort of thing.
Okay.
Okay. Hepatitis. There are 5 types identified of viruses that can cause inflammation and possible damage of the liver. General symptoms: loss of appetite, fatigue, mild fever, muscle or joint aches, nausea, vomiting, abdominal pain. Most never know they have it. Treatment: there are vaccines to help prevent hepatitis A and B, but not C in others. There are medications to help with the viruses, symptoms, and complications. Some persons get rid of the virus on their own. With medication, many respond to and have been cured of hepatitis C. And we do have vaccines. We do have meds now, that our infectious disease specialists, that individuals can rid themselves of hepatitis C now. Complications, they are acute, 6 months or less. Symptoms may last several weeks to months. Hepatitis B and hepatitis C can lead to chronic, more than 6 months. Hepatitis, which can lead to liver cancer, need for possible liver transplants, and even death. So you need to understand that once you start to ruin your liver, uh, that's something that we cannot reverse. Okay, that's a
Yes.
very big step. Okay, CDC recommends persons born between 1945 and 1965 to please get screened for hepatitis C, and those with risk factors, testing by blood sample. Get vaccinated for hepatitis A and B. Check with your local health department or healthcare provider. And might I add, CareSouth, we do
Yes.
issue hepatitis A, B, C testing free.
Okay. So free. That's free. All right.
That's the name for me, free. And our last one, I'm not sure, is HIV/AIDS. What is HIV? It stands for human immune deficiency virus, a virus that attacks the immune system of the host. You can't tell from the outside of a person if a person is infected or has had their blood tested. Next slide. What is AIDS? when the virus shows symptoms, acquired immune deficiency syndrome. The symptoms of HIV viral infection when the immune system has been fully attacked. That means your viral load count is high. Symptoms after infection can vary greatly with timing, but some cases can take 10 years before signs show.
Wow.
Most persons never know they are infected by HIV until they feel real sick. AIDS symptoms occur or detected by HIV screening. HIV screening is very important. Try to catch early for better outcome. Now let me go back a minute. Let me go back up on the top of the screen. I don't want you guys to get that 10-year mixed up.
Yeah.
I've had that so many times that people think that you will not be able to tell that you're positive until 5 or 10 years from the day you are infected. That is not true. If you have sex with an individual, let's just say in January, and they infect you, no later than 3 to 6 months, definitely no later than a year, you will know if you have been infected with HIV.
Wow.
Okay? You need to get tested. I share this with everybody. I have been married to my husband for 24 years now, but there's not a year that goes by that I do not get tested for HIV.
Same here.
Okay? Until the day comes that you can screw them off and put them in your purse. Always remember that. Always remember that.
Thank you.
This is just the changes of the faces that we see in HIV. Back in 87, I don't know if you all really, was really in with it then, but HIV was just really a white gay man's disease. That if you was not gay and you were not Caucasian, no one really worried. But today, as you can see, if you notice that with the new medications we have today, many can live longer and productive lives. And it does not have, HIV does not have a face that stereotypes anyone.
Okay, thank you for that.
HIV treatment. There is no cure at this time. There are meds that can help for you to live a longer and more productive life. Early detection, which means being tested for HIV, is a better outcome. Get tested. And again, I will say, if you are having unprotected sex, married, single, whatever, please let getting an HIV test every year be something that you do to protect yourself every year.
Is that something you can do over there at CareSouth?
I'm sorry, Maureen.
Is that something you can do over there with y'all?
Of course, yes. We offer free HIV testing here as well.
Yes. Okay, so it's free with CareSouth.
There's that free word again. Yes. Yes.
And I just want to say that that's very, very, very important that, these services are offered free. So there's no excuse for you not to get yourself tested.
That's right.
So I urge all our participants, all our followers that, once you live in the ED region of South Carolina, between the counties of Florence, Darlington, Chesterfield, Marlborough, Dillon, and Marion, I would say. It's free at CareSouth. So there's no excuse for you not to get yourself tested for sexual transmitted diseases.
Yes. And this is something that we are really working on here in our department because we have got to break the cultural change. We've got to break that. And we've got to start, and we starting it and we're doing it. And this is just something that we've got to save our brothers. We've got to save people if it's just one a day. Common myths about STDs. And listen at these very carefully. If I or my partner use birth control, there's no need to worry about STDs. Okay? If you are using birth control, that is just what it is. Birth control.
Birth control, yes.
That just means that you probably will not get somebody pregnant or nobody's not going to have a baby. That is not going to prevent an STD. Okay? Oral sex and anal sex are safe sex or not sex at all. This second myth is something that's very popular in high schools. We have a lot of young ladies. We have a lot of young men that feel like if they have anal sex, they're still saving themselves because nothing is going on in the poop area. So, you're saving that vagina area for when you get married. Also having the oral sex, you're saving yourself. That's far from it. Okay. Um, there is a cure for HIV. There is a cure for HIV/AIDS. That is a myth. Sex in a hot tub, sex standing up, jumping up and down, douching after sex will prevent STDs, including HIV and or pregnancy. Totally untrue. More common myths about STDs. STD testing, including HIV screening, is for cheaters and players. As I said a couple of screens back, I have been married to my husband for 24 years.
Every year.
I'm too old to be a cheater and a player. I
like it.
If he pulls out, the partner will not get pregnant or get an STD. That is not true. I think on one of the slides we were talking about pre-com. So guys have to understand that before you get that total sensation or know that you're really getting ready to ejaculate, there is pre-com. Okay. If you get an STD, including HIV, there's nothing that you can do about it. As we have been told earlier in the slides, there are treatments and cures that you can do. Okay.
Yes.
You can also tell by looking if you or someone else has an STD or an STI. Would know if I had an STD. That is not true. These are all false. Notes about STDs. Prevention is important. Many do not know that they have an STD and may appear healthy looking. If giving antibiotics or medication, take as directed and do not share with others. If you are given a 7 or 10-day prescription for an antibiotic, it is very, very important that you take your prescription. Even if you start to feel better, you must take your antibiotic prescription the full dose. Okay? Do not have sex while taking an antibiotic or similar medication until completed, and or sex care provider instructs you to do so. You do not want to transmit the STD to another person if possible. Bacteria and parasite and some viral infections can be cured with prescription medications, but remember, you can get reinfected again. Okay? So while you're on your antibiotics, do not have sex with anyone else. Because you can be pretty much clear, like I said, but you're still having your meds to take. But if you are still having sex with the same person who you have not informed that you are on these antibiotics for an STD, they will reinfect you.
Okay.
Next. Ways to prevent STDs. My number one is abstinence. Avoid sex, anal, vaginal, or oral. Monogamous relationships. Limit sexual activity to one partner who has no other partners and documented good health. Documented HIV negative. Both partners need to get tested for STDs and HIV. Communicate openly with your partner. Remember what I said earlier. Talk to each other. Cut the light on. Look at it. Trust and respect assist in sexual health and can reduce STDs by making choices, good choices, and sharing information together. Use protection consistently every time and correctly. If you are not sure, we have some guys, some men, they just automatically think that they know how to put condoms on. I have seen it so many times. There are a lot of men out there that do not know how to put a condom on correctly. Please make sure that you know how to put a condom on. There's no such thing that your penis is too big and it bursts the condom. There's no man hanging like that will burst a condom. Condoms can fit over an entire person's head.
Thank you.
All right. Wait. These can be given to a person who is not infected to prevent acquiring certain STDs, such as some types of HPV, hepatitis A and B. Check with your local health department, healthcare provider to see if you can be given vaccines. Avoid alcohol and recreational drug use. These can cloud judgment, not use safe sex practices, and avoidance can help reduce STDs and unwanted pregnancies. Persons who do HIV, who do IV drugs and I'm sorry. Yes, I'm gonna come back. I'm coming. I'm almost finished. Okay. Yes, ma'am. Okay. Thank you. Avoid alcohol. I'm sorry about that. I apologize. That was my provider. Avoid alcohol and recreational drug use. These can cloud judgments, and avoid can help reduce STDs and unwanted pregnancies. Persons who do IV drugs and contract hepatitis and or HIV could possibly infect someone through sexual contact. Next slide. Ways to prevent STDs. Talk to your children at an age appropriate level about sex and keep communication open. Talk to your child's healthcare provider if you need help with resources. And I really need to stress this. Please talk to your children.
Yes.
There's not a set age that is set in stone of when you speak with your children. Children develop at different ages. They are introduced to things at different ages. I've always used the saying, if they are old enough to bring it to you, then they're old enough to know what's going on.
Yes, have that conversation with them.
Yes, please. This is just STI numbers in the US. Then this is per year. Don't take chances. You make the choices to practice prevention, get tested, and seek treatment if needed. Resources to get tested if you think you have an STD. Call your local health department and set up an appointment for you to get tested. They will need to collect blood, urine, and possibly genital area bodily fluids to do complete testing of STDs.
All right. Or you can come to CareSouth Carolina. We do all of those tests.
Or you can come to any of your local CareSouths, and we will be more than happy to help you.
Okay, well, now I've been waiting to ask this question, all right? And I mean, as a father and also as a husband, I do believe in, keeping it with one partner. All right, but yes, we do know that we do have parents out there who are unable to hold it down with one partner. And, they are very sexually active. What would be your advice when it comes on to doing checkup for them? How regular should they do checkups if they choose to be sexually active with different partners, I should say?
Just continue. You need to get tested every year. And again, you need to understand the importance of practicing safe sex. I mean, there is just no way around it. STDs and STIs. This is just a conversation that a person is not going to just set you down and talk to you about. Okay. A lot of times individuals feel like that they are not going to speak on it because it's just straight up selfishness, or they are not wanting to know. I've done a lot of research in this, and I've come to know several individuals. People just don't want to be alone. They just don't want to be alone. And if they are not wanting to share with you what's going on, a lot of times that's what it is.
Okay. Another question. A parent has a teenage child or kids, and they don't know how to talk to them about these issues. How can you help those type of parents?
You can you can bring it up. Now, sometimes you just really have to know your children. You have to really know your kids. As you can see by watching television these days, I remember when I was young, they would not show individuals in the bed together until after 9 or 10 or 11 o'clock at night.
Yeah.
You can see now
Different era,
commercials
yes.
12 and 1 o'clock in the day. They are showing commercials of individuals being intimate together and things like that. Again, all of our bodies, we know our bodies and we know the feelings, we know the urges, we know things that happen. So sometimes it's a parent's responsibility to take that step. And I'll do you one better. And I've had a lot of people to say, Miss McQueen, I never really gave it much thought. You can share with your wife, or either you can do it. I'm the one that washes clothes in my house, and I'll share this, and I don't mind sharing it. When you're washing your children's clothes, you can look when you're washing the panties and the underwear. If it's stiff down there, you know that something is causing these feelings to
Okay.
come in their bodies. And you'll need to say, okay, now I know something is going on here, so I need to take this step.
Okay. Thank you for that. Because
You're welcome.
I do believe just based on experience, kids are having kids, I should say. Children are having children, and because they weren't exposed to this type of conversation with their parents, I mean, they don't know how to deal with their kids where that is concerned. So you do have that gap of not informing, and they don't know how to do it. So you do have that group of persons wanting to do better, but don't know how to do better. And because of that, we want to reach out to them because that's very important that at least they can take the step of, making that transition to informing the kids just in case they start noticing the changes as you mentioned just a while ago. All right.
Absolutely.
Hey, Gillian.
Yeah,
Let me let me come on a little bit. My, I just want to find out because she did talk about when you discover that you're infected, maybe you have an STD. You need to try as much as possible to stay to yourself. Don't get your partner or maybe your kids, around you a lot. So maybe because sometimes I understand sometimes we play with kids and we might want to give them a peck or give them a hug and all of that, or maybe give them a keys. But I want to find out in a house where you have pets, how can you manage that situation? Because I know a whole lot of people, who have pets and they do a lot of stuff with pets, and these same pets have to, play with the kids and all of that. What's your
Mhm.
take on that, man?
I have never encountered anything of that sort as far as um, uh, females or males or individuals with pets. Um, I've never had an encounter and I've never had a question asked on that. I would think that, pets would not be an issue or be any harmful in any way with anything. I wouldn't think that. But that is definitely something that when I hang up, I'm going to um, I'm going to inquire about it. I'm going to look it up and I'm going to see if I can find out. And actually, I'm going to ask my provider why I have her here. Is it something that we need to look at when it comes to pets?
All right, man. All right.
Okay.
All right.
All right, Miss McQueen, thank you very much for taking the time out to do this presentation. And Marika, just want to give you the opportunity for you to maybe speak to our audience in relation if they need to come and do any testing or services with CareSouth.
Yes.
Go ahead. Hope.
Um, yes, please. If there's anyone out there that feel that they may be in need of testing for HIV and or AIDS or any STDs or anything of that sort, please do not hesitate to give us a call. You do not have to state your identity at that time. If you have a question, just please know that no question is a stupid question or a dumb question. That
That's
one
right.
question could very easily save your life. And we're here. We're here to educate and we're here to help you. Okay, so we are available. Anything that we can be of service of to help you out, just please give us a call.
All right, man.
And just to, if I could, Hope's Department, Care Innovations, they do a really, really good job of testing, prevention, and education. And if I could plug in our website is www.caresouth-carolina.com, or you can call any CareSouth Carolina site um, and get in touch with them and go to the call center. If you need to get in touch with Care Innovations, you can do so that way.
Yes, absolutely.
All right. All right.
Okay. Thank you very much. And also, let me just add to that that all testing for any sexual transmitted disease is free, right?
It is
Yes, sir.
free.
So that's an
Yes, sir.
encouragement to go ahead and get your free testing at a CareSouth
Yes, please.
location.
We have tons and tons of tests. So we are here and we're willing to help out any way that we can.
Yes, and I do believe that just in case you are unable to afford prevention like a condom, like condoms, I mean it's free also, right?
Yes, sir. We have over 10,000 on hand right now.
Okay,
All
very,
right.
very good. So once you're living in the PD and you do fall short of any prevention, I mean, visit your local CareSouth office, and also you can also come to the Antiman office because we do have also stocks here provided from CareSouth. So thank you very much.
Yes,
No,
sir. Thank you guys so much.
All right,
we
man.
do,
Thank you so much, man.
yes, it's good to know that we do have a wonderful partnership with CareSouth Carolina. So yes, we will
Absolutely.
continue
And
to
it
work
was a
together
pleasure meeting.
in
It was a pleasure
providing.
meeting all of you guys.
Yes, we'll continue to work together in providing, health information for our fathers, for parents, and also for our community within the PD, and also extended outwards. What I'll say is that for you to get more information about the Man-to-Man program, please feel free to go to our website at www.mantomanfathers.com. Our telephone numbers are 843-676-0407 or 843-479-4177. We also have offices located in Bennettsville, Marlborough County, and in Florence. All right, so please feel free. I mean, our Facebook page is here also, so you can get more information. And also, if you do know fathers that do need help, because that's our main goal, helping men become better fathers. It's very important. Fathers are important to the family structure. And it is proven that whenever fathers are not in the home, that child is more likely to get themselves in trouble. And that's a fact. I mean, if you check the prisons, if you check the high school dropout, everybody. I mean, fathers are very important in order to stabilize the family. So I just want to say that. But I just want to say thank you very much to our guests. And hopefully next week again we'll be talking about more health issues. I will go through this men's health topic. So have a great day and see you all later. All right.
Thank you
All right.
guys.
Okay.
All right,
Love
man.
yourself. Love
Yeah.
yourself.
Okay.
Thank you,
All
man.
right.